We will begin the presentation in about 1 minute. Tracy, I have 2 o'clock if you want to get us started.
Good afternoon. Thank you all for joining us today for our weekly update from the Health Department regarding COVID-19. We have some questions that our executive team will be answering shortly. I am going to also want to remind you as we walk through this that if you have questions, there's a chat box that you can type your questions in. I'm going to turn it over to you, Mr. Crabtree, and let you give us an update of COVID-19 over the past week.
All right, so you'll see a side view as I read our situation board here. In Adair County, we've had a total of 102 cases. 19 of those passed away, 79 are recovered, leaving 4 active cases, 3 on home isolation, 1 in the hospital. We've had 10 total cases in Casey, 0 deaths, 7 recovered, 3 currently active, all on home isolation. 5 total cases in Clinton, no deaths, all recovered, no active cases. Cumberland, 5 total, 0 deaths, all recovered, no active cases. Greene, 3 total, 1 deceased, 1 recovered, 1 active case on home isolation. Macquarie, 13 total, no deaths, 13 recovered, no active cases. Pulaski, 74 total, 2 deceased, 64 recovered, 8 active cases, 7 on home isolation, 1 in the hospital. Russell, 38 total, 4 deceased, 25 recovered, 9 active, 8 of those on home isolation, 1 in the hospital. Taylor, 21 total, 1 deceased, 14 recovered, 6 active, all on home isolation. And Wayne, 10 total, 0 deaths, 9 recovered. It seems like Taylor County over the last week has been the most hard hit county. That puts us at 281 total cases through the end of yesterday. So far today, we have added 4 more cases, 1 more in Adair, 1 more in Pulaski, and 3 more in Taylor. In Taylor, we're having several cases that related to a church exposure. So we had made contacts with the original case that was at that church, and several of the worshipers were on home quarantine already, and some of those are turning into active cases now. Unfortunately, they're already on home quarantine, so that helps to reduce the spread when you can get in there and catch it early. So, Tracy, I think I'll stop there with my introductions, and some of the rest of the things I say, I think will weave into the questions that's been posted. Tracy, I think you're muted in case you're talking.
Thank you. I'm sorry. Some communities are going ahead.
You might remind people about the chat box too, if they want to ask questions.
Yes, and if there are questions, please do put those in the chat box. First question, some communities are going ahead with public fireworks shows and other events. Is there guidance or new guidance out there on events or on fireworks that's came down from the governor?
As of this time, we don't have any other guidance than what's out there. So we don't have anything on 4th of July celebrations. what we do know is of course, up until the 29th, the 10 people gatherings are fine, and 50 people gatherings as of July 29th. But any formal guidance, we don't have that as of this time.
Okay, thank you, Stuart. Next question. Have officials decided that the economy and the public cry out against closures will rule the day, or is the virus just not as dangerous as it was a few months ago, or as some reports have said?
I think me and Sean will probably answer this together. I'll start out, and I will say that the health department is actively providing guidance from the governor's office as requested from any business or any entity. It is true that the public has seemed to lose interest in coronavirus. However, we know, just as Sean alluded to, that 5 cases in today, and we know that we've had at least 4 churches in the past week and a half that have had cases, and now looking at an outbreak in these churches. So, we still encourage people to stay away from crowds, to wear their masks, to socially distance when they're out, to wash their hands frequently, and to increase sanitation. And I will give the floor over to Sean and let him add.
Thank you, Stuart. I added to that question that understanding that there is a widespread complacency on following the guidance. I'm talking about in the general public, and of course, I'll qualify that statement by saying, we only see what we see when we're out. I don't know how many people are, social distancing and avoiding crowds. The people I don't see, the people that are staying home, I don't see them because they're staying at home. I do see that there are people that are out. And the people that are out, there seems to be complacency when it comes to social distancing, avoiding crowds, wearing the masks, and so forth. I also understand the health department has limited enforcement authority on a lot of things that people do. All we can do is really strongly recommend that everyone who is interested in protecting themselves or their families, follow the guidance that we've been given. That we've been giving out, that you social distance, meaning you stay 6 feet from others. You avoid crowds, you stay home if you're sick. If you have a fever or a coughing, that's really, really important. That you wash your hands thoroughly and often, and you increase your sanitation practices. We strongly encourage the public at large to wear masks. Masks seem to be really helping out in protecting people. Well, it keeps you from emitting your particles farther. The mask helps contain that in it, and it helps prevent the spread. So that's really important. In a related vein to that question, there was some questions submitted on social media, Tracy. One of them was that it said that why is it that some of the elected officials locally are not posting COVID-19 updates when others are? And, I've had a couple of pretty meaningful conversations with some of our local elected officials in the last few days to get their perspective on things. And I wrote this, I said, the county judges and other elected leaders are under a tremendous pressure to see things get back to normal. I said, we must all be sensitive to the fact that COVID-19 not only impacts health, but it also impacts many other important aspects of society upon which we all very much depend and enjoy. So it's a difficult position that our elected leaders find themselves in. I said that through these difficult times, we should try very hard to be understanding in regards to all the challenges that is out there. If you want your local elected officials to post more updates, I would suggest you just reach out to them and ask them to do that. Generally speaking, they try to do the things that their constituents want to do if they're being asked to do reasonable things. We do provide to the county leadership real-time COVID-19 updates. As I'm notified of positive cases, I notify the county officials, and we do provide a daily status report So that information is available for them to post. One of the things that I was talking with one of the officials, they were telling me, well, we've been looking at the information and the data, and the data doesn't suggest that things are that bad. They said we've never really come close to exceeding our hospital capacity, and as far as total impact, this has still only impacted a fraction of our population. And I can't argue that those statements aren't true. Those statements are true. But there are other parts of the statistics that we look at, and I guess which statistics you focus on depends on which perspective you're coming from. If you're coming from a public health perspective, you're going to look at the numbers in a different way than if you're looking at it from maybe an economic perspective or a political perspective. Not that either side is wrong. Both sides' opinions are valid, and you can make good arguments. But here's some things that I think about when I'm looking at the numbers. At any given time, it's a very normal thing that hospitals have 70% more of their intensive care unit beds in use. I mean, even though there's a number of ICU beds available in hospitals in our communities around the state, they just don't lay vacant waiting for COVID-19 to flare up. Most of the time, their beds are in use by other people that don't have COVID-19 that are sick and need intensive care. So just because you see a total ICU bed count doesn't mean that that's the number of beds that are actually available. Maybe 30% bed capacity is available at any given moment. So just keep in mind that the bed capacity in the hospitals for these types of things isn't as much as you might think. I was looking back at the data today, and these are the kinds of things that we look at from the public health perspective. When back before the economic shutdown and the social distancing, the week of that ended April 4th, our new cases in our district was doubling almost every day. For that previous week, the growth rate, they had doubled almost every day. Now, it did slow down a little bit the next week, so by the end of April 3rd, it had slowed down to doubling every 1.8 days or almost every 2 days. But as you look at that information, if you think, well, if it had continued at that growth rate, we had 41 total cases on April 11th, and it continued to grow, let's say, every 2 days. So, if the growth rate, would have been every 2. So where would we be? Well, by the end of 4 or 5 weeks, we'd have been up to so many new cases per day that it would have exceeded our public health capacity to respond. We wouldn't have had enough staff to be able to respond to all the new cases, to do case investigations and contact tracing and do isolation and quarantine. So we were about maybe a month away from that. And the next week, the hospital capacity, assuming that all the beds that they have would have been available for COVID patients, which they wouldn't, we would have exceeded that capacity then, probably sooner. So that's concerning. Now, after the economic shutdown, things kind of reset. I'm not looking at total cases. I'm just looking at active cases. And on the week of June 6th, their active cases were doubling about every 3 days. Now, it did slow down since then some, and we're watching to see how this week unfolds. But let's just say that they continued to double at the weekly double rate was 3, or doubling every 3 days. So, just as recent as June 6th, if that growth rate had continued, we were again about 4 weeks out from being overwhelmed from a public health perspective, and about 4 weeks out from being overwhelmed from the hospital perspective. So we look at those things, and that's what we want to avoid. Now, I understand that we have to reach some kind of balance as a society between the economic concerns and the public health concerns, and we have to figure out just how much normal can we live with without having COVID-19 flare up to the point that we overwhelm the public health or the hospital systems. And hopefully as a society, we can take COVID-19 serious enough and take individual steps to mitigate it so that there's no threat of an economic shutdown again. As I said, there is hope. We have seen COVID-19 be mitigated or contained in very difficult circumstances, such as in nursing homes or factories or jails. And if you can contain the spread of COVID-19 in those situations that are very difficult, you can contain it out in public. But you do have to observe the precautions of avoiding crowds, staying 6 feet from others, wearing the mask, washing your hands. If you don't do that, you're giving this virus a chance to spread much more quickly. And it's the last 2 weeks have been tough weeks for us, and this week so far is looking like it'll be a tough week. Now, if we're growing by 23 cases a week and it never gets any worse than 23 cases a week, we can handle that. We can handle a considerable amount more than that, but there is a breaking point. So I would just encourage everyone to always social distance and wear the mask, wash your hands, try to avoid crowds. Don't think COVID-19 is done with us just because we feel like we're done with it. Mother Nature's don't really care about whether you're done with it or not. It's going to do its thing. So let's hope as a society we can work our way through this without having a major spike or any other kind of shutdowns. Just want everyone to follow the guidance. So Tracy, that was a very long answer.
It was, Sean, but thank you. And Stuart, I think the next question may fall right along that also. We've been hearing the number of cases are on the rise. Overall, are we safer as a district from the virus now than we were 3 months ago?
We're no safer. If safe is defined as, am I going to avoid getting this? No, we're not safer, but we understand better how to reduce the risk. We know we can reduce the risk by wearing the mask, by staying 6 feet from others, by avoiding crowds, by washing your hands and sanitizing. So we know what we need to do to reduce the risk. So, maybe an advantage that we have, or a few advantages we have now as opposed to when this all started several weeks ago, maybe now people are aware enough that COVID-19 is actually out there, that if they start feeling symptoms, that they're quicker to get tested and the test results come back much quicker, and maybe we can intervene much quicker. If we catch a case early enough, we can reach out to those close contacts that were exposed, and we can quarantine them before they become contagious and reduce the spread. So, probably in our district, when this was just, when our district received its first case, there was, COVID-19 had probably already been in the district for a few weeks before the first case was identified, and it was doing its thing. It was spreading around, and maybe it was only impacting young people and people were asymptomatic. But by the time it started hitting, it was in, and it was tough to get a handle on. Hopefully now, like I said, we're aware enough that it's there, that if we start feeling like we have symptoms, we get tested quicker. There are, businesses by and large are trying to comply with the recommendations. Maybe that helps us out a little bit, even though I don't see a lot of the public social distancing or wearing masks when they're out at the stores. Maybe the fact that the stores themselves or the businesses themselves are following the guidance, maybe that helps us a little bit. And there's probably a good number of people that are in our population who are taking the guidance serious, and we see people out, but if they're staying home more, then we wouldn't see them because they're at home. So, there's probably more people who are taking the guidance serious than you can just tell by going out and looking. So maybe we do have some advantages, and maybe that makes the risk a little lower. I would sure be a whole lot more comfortable if I felt like everyone was really trying hard to avoid crowds as much as they could. And when you're around people, stand 6 feet apart, and that you wear a mask and you're washing your hands a lot. Stay home if you have a fever or coughing. Certainly, if you start having symptoms, fever or coughing, any of that stuff, get tested quickly and help us to respond. we understand we can't stop the spread of the virus completely. The goal is to mitigate. We don't want too many people becoming sick too quick as they overwhelm the public health or the medical infrastructure. So the public can help us out by doing the things that we recommend as far as the guidance.
Okay, thank you, Sean. Next question. I have heard about 60% of the current cases are asymptomatic. Is this correct in what is being said? And this could, I'm sorry, and could this be because public health are offering testing events for antibodies?
Dr. Wayman and I worked on the answer to this question. You want me to go forward or you want it? Okay, so, we only know about cases we know about. If someone gets tested and they're positive, then, we're notified about the cases we know about. There are people out in the communities who are asymptomatic, who've had it, no doubt, but we don't know how many that is because we have no way of knowing. In the places that have done those kinds of studies, it's not as many people as you might think, maybe 15 or 20% of the population. So there's a lot of people out there that can still catch this. But of the cases we know about, since this thing started all the way up until today, of the cases we know about, approximately 10% of those are asymptomatic. Now, after May, if we just look at the numbers since May, we're seeing 25% of the cases are asymptomatic or not showing symptoms. And that change is because a whole lot more people are getting tested, through these mass drive-through clinics and things like that. So, in the early stages of our response, testing wasn't widely available, and we were only encouraging people who had symptoms to get tested. So now, anyone can get tested. So yeah, you're going to identify more asymptomatic cases. However, we are seeing that in these mass drive-through clinics and things, there's not a whole lot of cases identified in those mass clinics. There is a few, and that would account for some of the change in the numbers, but most of the people that end up being positive cases are people who feel themselves getting sick and they go to the doctor and they get tested and they have it. Or there's like if you're going for some sort of elective surgery or something now, there's a requirement you test before the surgery. Sometimes we're finding cases like that, and sometimes they're asymptomatic. But anyway, I hope that answers that question. There's one over in the chat that says, what is the date for meetings of up to 50 people to take effect? Will a fast growth rate halt the meeting of up to 50? Things are supposed to open up to 50 on June 29th. And do I think a fast growth rate would halt that? I don't know. Things would have to speed up a lot faster than they are right now. My feeling is that most people are ready to, get life back to normal. I don't think the governor, certainly, I don't think he wants to shut things down again. I think it would take a really difficult situation for us to go back to that. What we're hoping for, at least from the public health perspective, is that never becomes necessary, and that people will take the precautions they need to slow the spread to the point that it won't spread so fast and we have so many people sick at any given time that public health and the medical infrastructures are overwhelmed. We know this thing's going to run its course. We just don't want it to happen all at once, or over the course of 5 or 6 weeks. It's better that it spreads out longer so that we can not have ourselves overwhelmed. So, Tracy, do you have any other?
I don't, Sean, but I might want to just add a thought, because there's several people joining us, and a lot of the media across the 10 counties are joining us too. So you might just want to share with them and ask them if they will help us to reinforce those guidelines and recommendations out continually across their communities.
Well, my message would be, we do want to be hopeful. We want to give people the hope that you can reduce your risk, and by doing the precautions or by observing the precautions. We do know that this has been contained and mitigated in difficult environments like nursing homes and jails and factories. So, we know if it can be contained and mitigated in those very difficult circumstances, that it can be contained in the general public. It's just a matter of people taking the precautions seriously. It can also spread very quickly in the general public. You can just Google COVID-19 any day, and there's going to be, dozens and dozens and dozens of news stories about 16 people show up positive at this setting, and 25 people show up positive at this setting, and another one, 70 people exposed over here. So, it can happen very quickly. So just use good judgment about those. So if the media would just say to folks, we don't have to have an overwhelming second spike. We don't have to see the economy shut back down. If the public would take the precautions seriously, that stuff could be avoided. I know that I gave some statistics a while ago about, how many weeks we were away from our capacity being overwhelmed. I certainly hope we never get to that. I hope all the people out there that say we're overblowing this ultimately, I hope it doesn't. I hope it goes as easy as they think it's going to go. This is a virus that's going to run its way through the whole population sooner or later. I will add that Kentucky has done better than national averages on most indicators, and Lake Cumberland has done better than state averages on most indicators. And there's reasons why we're doing better. Some of that is because when the cases were identified, the health department immediately made contact with those cases and figured out who their close contacts were, got them isolated and quarantined so they wouldn't be spreading it. Also, we went into nursing homes. We went into factories. When there was a case in a factory or a nursing home, we went in to make sure that the factories or whatever the business, we went in to help them and to advise them and to share with them, these are the things you need to do to protect people. There's probably some people still in here that could have it, and these are the things that you need to do, and they did that. And we've seen in other places in the nation where meat packing factories have been shut down. That's in the news a lot. Well, we have meat factories in our district that have had cases that haven't had to shut down because the infected population and the close contacts were removed, and the business took some environmental measures, sanitation and distancing and masking, and did the things they didn't have to shut down. Now, there was a disruption. Some people were off for a while, but they didn't have to shut down. They got to get their business back rolling pretty quick. So, public health in Lake Cumberland, we've done a good job. The businesses have done a good job, and the public up until this point has done a good job. In the last few weeks, I would have really liked to see more people wearing masks and trying to stay away from crowds, and hopefully that don't result in a significant growth. All right, there's another question. Ricky Craig, that's Judge Craig, I think, says, we're getting questions on when gyms can offer bigger class sizes. Any updates on this? Stuart, do you know the answer to that?
I'll tell you what, let me see if I can find.
He's going to look that up. So while he's looking at that, we'll jump down to the next one and swing back around, Judge Craig. Is there any guidance on children's events such as church events or birthday parties? Well, that's Stuart too. So Stuart, while you're looking, why don't you look for that? If you're looking for that, I will say, these kinds of questions from a public health perspective make me cringe because, it's all of these things are wanting us to say, okay, here's the day we can get more people together. And just because you can do something doesn't mean you necessarily should. We want all the restrictions to be lifted for everybody to be able to do whatever they want to do. But as you're going about doing whatever it is you want to do, we want you to think about not being around a bunch of people and we want you to think about keeping your space, and we want you to think about washing your hands and wearing a mask. We want you to go back to normal as much as possible, but normal observing that guidance so that we don't have a big outbreak. So, Stuart, did you find the answer to question 1?
Yeah, I believe the judge, I think he would be referring to workout, fitness center, type gyms. And that is still with, it looks like the 10, separated by 10 foot or more when it's in-person fitness classes. Of course, if you have machines like your racks and your weight machines, 6 foot apart. Now, I do know that right now it does say 33% capacity. There are other things that have been going up to 50% capacity a month from the date that they were allowed to open. So restaurants, for instance, from May the 22nd at 33% to June the 22nd, they'll be allowed to go up to 50% capacity. I have not heard anything about that on fitness centers, but that may be the case coming out with those also, that from the date that they were allowed to open, which was June the 1st, they may be able to go up to a 50% capacity July the 1st. We would just need to wait to hear on that.
Since if once you get a more definitive, you can get with Judge Craig about that. So Judge Stuart will get with you with, if that's not a totally definitive answer, he'll get you on when he has time to look.
And I will say, just so everyone knows, usually when the health department knows about reopenings is the same time that the public knows. That's been the case with everything so far. It gets posted on the Healthy at Work website, and we're not privy to that information before it becomes posted. So in general, the same time that the public knows is the same time that we know. I can answer on the birthday parties a little bit. Again, that for right now, up until the 29th, the social gatherings have been limited to 10 as far as guidance. And June 29th, that would go to 50 people. And that would apply to a birthday party, just the same as it would any type of gathering.
Yeah. Now, again, just because you can doesn't necessarily mean you should. We want you to use good judgment. I was on a conference call with all the health department directors Tuesday, and the director from one of the cities, he might not want me to call out which one, so was talking about how now that daycares have started to open back up, and of course in the cities there's a whole lot more daycares, but he was talking about just how many they've had to shut back down. Now, they didn't shut the business down. What they did, though, is they had to quarantine and isolate the people who were coming, because there was cases that got into the place, and of course everyone ended up being in a close contact because they were all kids that were all over each other all day, and so the business wasn't shut down, but everyone in the place was isolated and quarantined because they'd been exposed to an active case. And that has happened, he said, several times. So just think about your kid. I know you want to get your kids out and with other kids and socializing and all of that. And the kids, generally, they do okay with this, but they still catch it and they still spread it. And those little kids love to run and jump in Grandma and Grandpa's lap. Grandma and Grandpa statistically don't do so good with this. So just, think this stuff through, guys, as best you can.
And there was another part of that question I failed to address, church events. So We know that churches, of course, as far as guidance goes, a month from the date they were open, so that would have been on,
June 9.
Was it June 9th, I believe, then, yes, the house of worship could go up to the 50% capacity. As of June 15th, then the churches were able to do their classes following the daycare guidance. That was what was put out there as best practice. So some questions about VBSs came up, the Vacation Bible School, and I think that would go right back to the same as the Sunday schools, following that child care guidance would be the optimal way to do that.
Yeah, and think about just risk. Staying 6 feet away from people, the logic is with a normal amount of time that you would be around someone, which is not an extended period of time, the longer you are in a room with somebody, even if you're 6 feet apart, the longer you're in that space together, the more risk you have. If you wear a mask, you keep more of your particles in. That makes things a little safer. If you're 6 feet apart from people, but they're shouting or singing or screaming or kids yelling because they're having fun, more particles are ejected, and that 6 feet space is not as safe as it was. So, you just gotta think this through and make good decisions. I'm like you all, I'm tired of dealing with COVID-19. I want it to be over, and I want it to say to everybody, go out and have fun and hug and let the kids play. And, I can't in good conscience tell you things. I know that we can't stop the spread of this, but I would prefer not to see it spread really, really quickly. It doesn't matter if it's a church or if it's a bar, if it's a movie theater, whatever it is, if you're in a pretty small room with a bunch of people, even if you're 6 feet apart, and you're going to be in that confined space for an hour or more, it starts getting tough to contain it. Even if if you're observing the guidance, those situations, it gets riskier and riskier. So, any more questions from anybody? Dr. Wayman, I've not given you a chance to say anything today. Do we want to think of a good medical question?
Part of that question that you answered about asymptomatic people, I realize they asked about antibody testing. Yes, some of those asymptomatic people have antibodies as the test that they've received. So just reply to that.
Yes. All right. So we got another question that came in. I think this is Judge Cowan in Adair County. Getting questions on wedding venues with outside ceremonies. We have several in our county. So that's another environmental enforcement related question.
Yeah. So Judge Cowan, again, still, no other guidance than what's on the Healthy at Work website. It's going to go up to the number 50, June the 29th. Of course, if you're looking at having a wedding and you're going to have guests and let's say you're going to have 50 guests, the best option is to do an outside event. You can space those people out. You're not in that confined area that we were talking about, whether it be a church or a dining facility or a movie theater, and you have that wide open air. So it would be much safer to do a venue outside than inside, but we don't have any further guidance on numbers besides the 50 gatherings on June the 29th.
Yeah. I can say I personally haven't eaten out at a restaurant in, I can't tell you how many weeks. I haven't, gone and hung out with groups of people. It's always been one or two, I have had to go into Walmart and grab a few things and get out. I wear my mask when I go. I'm not comfortable yet doing those things, so.
And I would agree with Sean. I mean, I haven't been out to eat since this started and haven't been inside the church building. I faithfully, and my family faithfully go to church on twice on Sunday and on Wednesday night. So we haven't been able to do that yet. We would like to get back to that, but you have to remember, I mean, with the outbreaks, again, these increased numbers that we're seeing in places like church, I think, if you could have an outside service, that is your best bet to come together and to lower that risk of COVID. And of course, if you can do it online, that lowers it to nothing at the church service. But people should take precautions, and especially those people that are more vulnerable to the disease.
Yeah. I'll say, since we got two judges on the line, I imagine they go through what we go through. I mean, they go through a lot of things being the judges in the county, just not public health stuff. But I mean, as far as Stuart and I, if I get 50 emails a day with complaints, 25 of them will be from business owners saying, you guys are being too hard on us. And 25 of them, well, if it's 50, 25 would be from business owners. You're too hard on us. 25 would be from members of the public saying, I can't believe you're letting everybody do this. It's like, okay, we can't really win here. We got half of the people's aggravated about one side of it, and half are aggravated about the other side. And of course, the judges have, on top of that, they have to think about how much society wants to go back to normal, and the economic impacts and all of that, which adds an extra layer of complexity for them. So it's tough. We're all trying to get through this the best we can. My best advice to everyone is to observe the guidance, try to avoid being around groups of people, try to stay 6 feet apart, wear your mask, wash your hands. If you're sick, stay home. Dr. Miles says, Dr. Wayman, I see where the FDA has approved a couple of antibody tests. Are those emergency approvals, or is there proof as to the sensitivity and specificity of those approved tests? So you got one from Dr. Miles.
I don't know that one. I mean, I've read some things about it. I don't know which one it is. I suspect it's still emergency, but I'll check it out and let you know.
Do you, Dr. Miles, do you care to send Dr. Wayman the studies you're talking about specifically, are you sure you know which ones he's talking about?
I'll just look at the FDA website.
All right. Well, anyway, if you all could just talk about that and make sure you're on the same page, or email or whatever.
I know one was suspended for emergency use.
One, yeah, I think I saw that this morning too. There's so much information that gets thrown out at any given time, and some of it is, misinformation and redirection and conspiracy theory, and some of it is these tests work and then the next week they don't work, and one week you're supposed to wear masks and the next week, masks weren't good, now masks are good. It's like, you can understand why the public. The thing is, everyone needs to keep in mind, this is a new virus that, it's not been around long enough to be studied and to understand, everything that's happening. There's confusion about why there's certain places in the world that's been less impacted than other places, and can't seem to figure out why. It defies logic. There's things about this that we don't know, so, we're all just trying to get through this the best we can. And we do know that for any virus where you don't have a treatment, you don't have medications to treat it, you don't have a vaccine, all you've got is what protects you against any virus. Wash your hands, stay away from people, avoid crowds. You know, that works. That's good public health. That has worked for many, many years, and it'll work through this too. So, anybody have any other questions? Our YouTube live feed is about 15 or 20 seconds behind our live feed, so I will, Tracy, I'll start letting you wind this down, and if any more questions pop in, I'll catch them before I hang up.
All right, thank you all for answering the questions. I want to say, if you all have questions, go ahead and type them in the chat box. If we sign off, you can send those questions in to the health department, and we will answer those, and we will put them actually on our show for next week. And that's all I have, Sean. Have you got any more questions?
No, I would encourage everyone to watch our website and our social media page for our daily brief. We give updates and try to give some interpretation of the data each day, so you can stay caught up by doing that. And we look forward to seeing you next week. We have 60 people watching live, and we usually have quite a few more watch it on delay, so we appreciate everyone that tunes in. Thank you all.
Thank you.
Al Gibson says, thanks again. And thank you for the positive feedback. And I will see you all later.